Hi guys, this is Preeti, second year MBBS student from Hassan Institute of Medical Science. In this video, I'll be teaching you the overview of nervous system and make you understand and remember by understanding the things, not just mugging up. Now I'll be teaching you about the nervous system. Nervous system will be having central nervous system and peripheral nervous system. Central nervous system is which is present at the central axis of our body. That is brain and the spinal cord. This is a brain and this is a spinal cord. This is a central nervous system which are present at the peripheral side. These nerves which comes from the spinal cord, that are peripheral nervous system. This is a peripheral nervous system. The entire nervous system is divided into the axial thing. What is present in the axis, at the central axis, is the central nervous system, that is brain and spinal cord, which are nerves which are present in the periphery, that are called peripheral nervous system. That is, nervous system is divided into central nervous system and peripheral nervous system. As I already said, that the central nervous system has brain and spinal cord. The brain and spinal cord is present in the central nervous system. Whereas in the peripheral nervous system, it may be afferent or efferent. Afferent means which takes from organ to the central nervous system. That is a brain, organ to the brain or spinal cord. This is a organ to the brain, that is a sensory. Afferents are also known as sensory neurons. Whereas efferents are known as from brain to the organ, they are known as motor. Motor means they provide motion after they innervate. So they are efferent. Afferent means away from an organ. Efferent means towards an organ. That is, these are sensory and these are motor. I hope you understood this also. And if we speak about the efferent, there may be somatic or autonomic. Somatic means they provide two voluntary muscles. If they provide the innervation to the voluntary muscle, they are called somatic neurons. Whereas if they provide innervation to involuntary muscles, are known as autonomic nervous system. Now I think you understood this also. Efferents were further divided into somatic and autonomic. Somatic always has single axon they terminate. Example is for these somatic nerves are all the cranial nerves. Cranial nerves, there are 12 cranial nerves. Out of these, only these are autonomic nervous system. This comes in 3, 7, 9 and 10 comes in autonomic nervous system. Everything will be somatic nervous system. Comes under somatic nerves. Somatic nerves provides innervation to the voluntary organs, whereas autonomic nerves provide innervation to the involuntary organs. Again, autonomic nervous system can be divided into two groups, that is sympathetic and parasympathetic. Sympathetic during fight and flight situation, these provides innervation, and whereas in parasympathetic, when we are calm, we will be having parasympathetic innervation. See, baby is calmly drinking milk. So during sleeping, relaxing, and when we are calm, there is no requirement of much this thing, relaxing, and for digestion we require parasympathetic innervation. Whereas in sympathetic, when you see snake or something else, when that is a scary situation or emergency situation, during emergency you need sympathetic system. Sympathetic system, you know that this is a thoracolumbar outflow. You know that thoracolumbar outflow means these are the spinal nerves. The nerves which are coming out from cranium, that is brain, are called cranial nerves. The nerves which are coming out of this spinal cord are called spinal nerves. Cranial nerves there are 12 cranial nerves, 12 pairs of cranial nerves. As both the sides we get, as the symmetry we get from both the sides. So we have 12 pairs of cranial nerves that are represented in Roman numbers. First cranial nerve will be olfactory nerve. Olfactory nerve for smell, that is all for olfaction, that is for odor, to take odor, smell, olfactory nerve, which is a somatic nerve. And second one, the somatic or sensory nerve, and it takes senses. And second one, optic nerve for vision. And third one will be oculomotor nerve. Oculomotor nerve provide the movement of the eyeball. All the intraocular muscles are provided by the oculomotor except S44 LR6. S44 LR6. S44 means superior oblique. You know that the oculomotor nerves will be 4 recti muscle and 2 oblique muscle. 2 oblique muscles, superior oblique, inferior oblique. 4 recti, medial, lateral, superior and inferior recti. All these muscles are innervated by that is oculomotor nerve, third nerve, except S44, that is superior oblique, is innervated by 4th cranial nerve, and LR6, lateral rectus, is innervated by 6th cranial nerve. that is abducent nerve. All these intraocular muscles are innervated by thyroid cranial nerve, that is oculomotor nerve, whereas SO4 means superior oblique is innervated by trochlear nerve, and LR means lateral rectus is innervated by abducent nerve. So you got this olfactory nerve for odor, and for optic for vision, oculomotor movement of the intraocular muscles, trochlear, this is a fourth nerve, this is also, so it supplies superior oblique. Trigeminal nerve innervate the sensory, it gives a sensory innervation on the face. A trigeminal nerve has further 3 divisions, it supplies by dividing into 3 separate divisions, it innervate the face, that is all ophthalmic nerve, maxillary nerve, and mandibular nerve. These 3 innervates the face. If we take this as a face from the upper lip, this is innervated by ophthalmic nerve, maxillary nerve, and mandibular nerve. This abducent nerve, as already told, LR6, this lateral rectus is innervated by abducent nerve, and a facial nerve provides innervation to all the muscles of the face. And vestibular nerve for hearing, vestibulocochlear nerve, as the name says, vestibulocochlear region in here. And the glossopharyngeal nerve, this comes in this thing, parasympathetic innervation, that is 3, 7, 9 and 10 cranial nerves comes in the parasympathetic innervation, and it also provides innervation to the glossopharyngeal from pharynx, and for the muscles of the tongue, intrinsic muscles of the tongue is supplied by glossopharyngeal nerve. Vagus nerve, it is a parasympathetic innervation, and again it supplies, it gives parasympathetic innervation to the stomach and all. And the 9th nerve will be spinal accessory nerve. As the name says, it has 2 parts, spinal part and cranial part. Cranial part again forms a recurrent branch and then goes into the brain and supplies the meninges of the brain. And the 12th nerve is name, hypo means below, glossus means tongue, below the tongue it comes out. So this name is known as hypoglossal nerve. And it supplies, it gives motor innervation to many muscles. And this is all you learned about the cranial nerves. There are 12 pair of cranial nerves and the functions of each cranial nerve. Now we'll see about the spinal nerves. There are total 31 spinal nerves. This is a cervical region, C for cervical region, 8 cervical nerves, cervical spinal nerves, 12 thoracolumbar nerves. You know vertebra, no? Similar way you write, cervical 7 vertebra will be there, thoracic 12 vertebra will be there, lumbar 5 vertebra will be there, sacral 5 vertebra, and coccyx just 1 vertebra. But only case this this is cervical, only 1 extra will be there. So cervical it should be 7, but it is 8 because in the first vertebra, if you write the first vertebra, it comes below the, this is a vertebra thing, below the vertebra there should be 1 nerve coming out of this, but only in the C1 vertebra there are above also, below also 1 nerve comes out. So in place of cervical 7 we write 8. There are 8 cervical spinal nerve, and 12 remaining everything same, 12 vertebra, thoracic vertebra there, so 12, 5 sacral fused to form 1 sacrum bone in adult, but initially it will be 5, so we'll write 5 only. This is all you should remember. Spinal nerves total 31. See 5, 5, 10 plus this year 10, 20, 30, 31 nerves out there. This is all you learn about the cranial nerves and spinal nerves. This classification you need to know in order to divide this sympathetic and parasympathetic nervous system. Sympathetic during the emergencies, flight, the case I already said that when you see snake or during exams, or if teacher asks you question, during those days, those time your sympathetic nervous system will be activated, and remaining when you are calm and quite having food, relaxing, at that time parasympathetic nervous system will be activated. Sympathetic means thoracolumbar outflow I have written, but you should know what is thoracolumbar outflow. The nerves coming from the thoracic spinal nerve, that is spinal nerves I already discussed, that is 31 spinal nerves are there, out of which 1 to 12 thoracic spinal nerves are included in the sympathetic nervous system, and lumbar, total thoracic and lumbar outflow, so we say the name thoracolumbar outflow. And parasympathetic nervous system. Parasympathetic nervous system include cranial from brain and from the sacrum. Sacral 5 sacral spinal nerves are there, so 1 to 5. And cranium from the brain there are cranial nerves total 12 are there. Out of that only 4, that is 3, 7, 9 and 10. 10 is vagus, 9 is glossopharyngeal, 7 is facial, and 3 is oculomotor. Only these 3 are These three comes under parasympathetic. The receptor for sympathetic and parasympathetic will be, for a sympathetic receptors will be alpha 1, alpha 2, beta 1, beta 2, and for parasympathetic muscarinic and nicotinic. Muscarinic again they have 5 subclasses, that is M1, M2, M3 and M4, M3, M4 and M5. These are the receptors which will be present both the receptor for sympathetic and parasympathetic. This is organ, you consider organ, each and every organ has all these receptors. This is they have alpha 1, alpha 2, alpha 1, beta, alpha 1, alpha 2, beta 1, beta 2, and then also muscarinic and nicotinic receptors. All the receptors are present in each and every organ. This is all receptors and everything you learned about the nervous system. Again, I'll be discussing about the autonomic nervous system in a detail. This is the brain and the spinal cord, from where these nerves will be coming. This is a peripheral nervous system, this is a central nervous system, this is a central nervous system, this is a peripheral nervous system. Peripheral nervous system, where there is single axon, this has somatic nerves. Somatic nerves has single axon, so single neurotransmitter is required. This is a neurotransmitter. Neurotransmitter is acetylcholine. Mostly the acetylcholine will be the neurotransmitter, except for a postsynaptic ganglion in sympathetic nervous system. Only adrenaline, noradrenaline or dopamine along with the acetylcholine might be there. For parasympathetic system, this is a ganglion you consider. This is a before ganglion, so presynaptic ganglion. This is a postsynaptic ganglion, after ganglion. So both this synaptic and postsynaptic ganglion, the neurotransmitter, this is a synapse. We can say that the junction between the two neurons we can say as a synapse or as ganglion. Both acetylcholine is the neurotransmitter in parasympathetic nervous system. So choline is there. No? So this parasympathetic is also known as cholinergic system, like cholinergic nervous system. And whereas this in sympathetic nervous system, presynaptic ganglion releases neurotransmitter as acetylcholine, whereas postsynaptic ganglion releases adrenaline, noradrenaline, dopamine. Sometimes only in a few cases acetylcholine is released. Mostly it will be adrenaline and noradrenaline. So this system is also known as sympathetic nervous system, is also known as adrenergic system, as adrenaline, noradrenaline is all there. This is when we are calm, parasympathetic will be activated. When we are like in an emergency situation, sympathetic will be activated. The somatic nerves will supply to the voluntary muscles. The parasympathetic and sympathetic, which are included in autonomic nervous system, are supplying the smooth muscles, that is involuntary muscles, smooth muscles, cardiac muscles, so which are involuntary muscles. This is all you learn about the sympathetic and parasympathetic and the overall of nervous system. If you find this video helpful and you find it is understanding rather than memorizing, please do like, share and subscribe to my channel, and appreciate my efforts by sharing this video. Sympathetic nerves will be from thoracolumbar outflow. So from the thoracic region and lumbar region, the nerves coming out from the spinal cord are these are sympathetic neurons. Sympathetic neurons, the ganglion will be away from the organ, or this is the organ or the site where it should act. This ganglion is away from the organ, whereas in parasympathetic system, that is parasympathetic is a craniosacral outflow from the cranium region, from the brain and the sacral region. The nerves are coming out, but this ganglion will be close to the organ. So in this case, this is a ganglion. The part before it is a preganglionic neuron. The thing after ganglion is postganglionic neuron. So in the parasympathetic nervous system, preganglionic length will be more than postganglionic thing. Parasympathetic, I have already told that during the calm, when you are calm and then quiet, you are relaxing, this system works out. So in digestive, during it increases the mobility and then secretion of the digestive system, and when you are relaxing. Relaxing means when there is no emergency situation, this system is activated. So the functions you can easily remember by correlating with that image, that is parasympathetic nervous system. When you are calm or sleeping or something, so the pupil will constrict. When during the sympathetic system, when there is an emergency situation, the pupil will dilate, that is mydriasis will takes place, so light enters more. And I said in parasympathetic system, all GI secretions will be increased. increased. So saliva, which comes under parasympathetic nervous system, saliva which comes under GI, also secretions of saliva also increased. And heart rate during the emergency, heart will be like pumped more, because during emergency condition we require more oxygen to our organs. So there is an increase in heartbeat during the sympathetic nervous system, whereas in parasympathetic nervous system, when you are calm, the heart will be beating slowly. Oxygen requirement is not that much. The heart rate increases here, so it shows tachycardia, whereas his heart beats slowly. This is a bradycardia. And there is a constriction of airways, because during the emergencies you require more air, you need more energy to run or something, do something. So these bronchial muscles will relax in these conditions, allowing the more air for moving. During relaxing conditions, they constrict and allows less air. And it stimulates the activities of stomach. Stomach is also comes under GIT. So the parasympathetic nervous system increases the GI motility and secretion. So it stimulates the stomach, that is GI organs. It stimulates the liver. Liver also comes under GI, and it stimulates the intestinal secretion and oxidation, the contraction of bladder. During the emergencies, you don't have the time to urinate and all. So this time bladder relaxes. Bladder relaxes means it causes retention of the urine, whereas this constriction of the bladder causes the urination. During the parasympathetic system, it provides urination. This is all you need to remember. When sympathetic nervous system is acting, during emergency conditions, sympathetic nervous system is acting, so you cannot urinate, and the pupil will dilate so that you see properly. And what all you need to remember in sympathetic oxygen requirement is more, so bronchial dilation will take place, and it inhibits all GI organs. And sympathetic nervous system, oxygen is more required, so heart pumps faster, and bronchodilation, air is taken faster, and then exchange of air will be faster. This is all sympathetic you need to remember. Whereas in parasympathetic system, it stimulates the GI organs. The motility and secretion will be increased, so all salivary glands, all stomach, intestine, liver, everything is stimulated. Whereas constriction of pupil takes place, we need not to require that much light. And urination takes place in the parasympathetic nervous system. Emergency situation, you don't have time, you think that so that you can urinate. This is all you need to know about the sympathetic and parasympathetic. That is, if you understand, this is so easy than remembering and memorizing the things. And outflow, you need to remember sympathetic with the thoracolumbar outflow, and this parasympathetic with craniosacral outflow. Cranial nerves, 3, 7, 10, 9 and 10, these 4 cranial nerves out of 12 cranial nerves are involved in parasympathetic innervation. Thank you. If you find this video helpful, please do like, share and subscribe to my channel, and appreciate my efforts.